Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of this show, I'm going to continue to talk about asthma. This is the fourth show that I'm doing on asthma, and this show will wrap up the series or wrap up the series. Asthma is a very common disease. Worldwide, there are 300 million people who suffer from asthma, and in this country, there are 25 million folks who suffer from asthma. Every day, 11 people die in this country because of asthma, which adds up to about 4,000 people per year. Altogether, 3 million folks visit the emergency room every single year because of asthma, and 500,000 of those folks get admitted because of asthma. It's a very common problem, and it's most of the time it is a genetic issue that results in somebody suffering from asthma. Okay, it's very common. It is 2.5 times more common in black and Hispanics than it is in Caucasians. And the reasons, of course, are numerous, and I've listed them in the previous shows, and I'm not going to go over them again. The fact is, when somebody has difficulty breathing, it's because there's an inflammation or spasm that is causing the problem in the bronchioles. The bronchioles are the tubes inside the lungs. Okay, now the inflammation is the result of an allergic reaction. That is, somebody inhale something by way of an allergen, and it gets into the tubes in the lungs. It causes a local inflammation. The inflammation results in the production of secretion. The secretions in turn blocks the tubes in a way so that air cannot pass in and out freely. That then creates difficulty in breathing. In addition to that, the very same allergens can also cause the tubes to become spastic. They go into spasm, and that causes them to temporarily close. And you need to treat that. Also causes air to be obstructed, and it can't flow freely. And the allergens, of course, are the environment and all the pollutants that is contained, which is getting worse and worse all the time. And as far as all the carbon dioxide that are being put out by the cars and the big trucks, and also all the fume that's coming from the chimneys of the different factories that are found themselves in the middle of the urban areas, etc. Folks who live in the rural areas are less exposed to these things. Consequently, they have less problem with asthma. It is a known fact that folks who live in developing countries who wind up coming to this country, which is, in my view, the greatest country that God has ever created because of its ability to help people, its generosity, etc. And they come here, and a month or so after they got here, they wind up wheezing, and before you know it, they're in the emergency room. And the reason why poor folks, namely black folks and Latinos and other minorities, have such a high incidence of asthma is because of the living conditions. They live in houses that are closed all the time because they fear of opening the door. And inside many of these houses, you find rats, mice, roaches, and other vermins that carry material on their bodies that when you inhale these, they release that in the inside the room, the house. When you inhale them, and you get through your nose, and you develop an allergy to that stuff. Similarly, people who have birds in the house, cats and dogs, and other animals that they keep, well, when these things shed all this stuff that they carry on their skin, you inhale that. And people are allergic to these things. So that can trigger off an asthmatic attack. So it's very, very important that we pay close attention to these things. Now, as far as the symptoms, I mentioned them before. It's basically difficulty breathing, and you're wheezing, you're gasping for air. And so you need to know, as an asthmatic, when it's time to be taken to the emergency room, to call 911. I brought with me this flow meter. This flow meter is a gadget that we use in the emergency room when somebody shows up with an asthmatic attack. We give them, we give this to them to blow in. They blow, and that gives us an idea how much air they can push out, and we keep that number. We write it down. Now, it's even more important if the person has one of these things at home, and they check their uh, peak expiratory flow that is normal for them every day at the same time, twice a day. They keep a log of that so that when they get into trouble, they're having trouble breathing, they use it again. That gives us a measure how much they did a few days ago, and they can't do it this time. That means that the tubes are all clogged up and they're having trouble. They're getting weak. The muscle in the chest are getting weak, so they can't breathe. And if they don't seek care right away, because they may wind up in respiratory arrest and they die. That's where the bulk of the deaths come from. Now, these folks, many of them, we give them nebulizers. In addition to the medication we give them to inhale and puff, some of them who are really bad asthmatic, they also have their own nebulizers at home, which is what we use in the emergency room to give them medication to open up the tubes. We give them albuterol type medication, Alupen, etc., in solution form by writing the prescription. And they know how much to use at home to put in, and we give them a prescription for the machine. They have the nebulizer machine at home, and they self-treat themselves that way as well. So it's very important that people who are asthmatic really becomes very familiar with the disease and its symptoms, and then what can do, and then when to seek help. So once they get in the emergency room, as I stated last week, we will quickly do one of these tests quickly that give us an idea what's the best expiratory flow this person can do in this particular moment. And then, so that's very important. We write that down. Then we quickly get a blood gas, because the arterial blood gas tells us whether the patient is retaining carbon dioxide or not. Because the weaker the chest muscles get, the less it is that a patient is able to put out the carbon dioxide. So therefore, they're retaining it. And the blood gas can tell us that. It also tells us how much oxygen they have in the lung, how much it is, because as the tube get clogged up with this very thick secretion, oxygen cannot be exchanged. So these people, oxygen concentration drops. And then so we measure those things. And then we quickly put them on oxygen, give them nasal oxygen, and very easily. And then we put the nasal oxygen on. We get the chest X-ray, and then we give them nebulizer right away. And the doctor write a prescription. The pulmonary nurse there, or the regular nurse in the ER, they give them the nebulizer treatment. Okay, and then we watch them. Then we put an IV in. We give them a dose of steroid. Well, what's the purpose of the steroid? Well, the steroid is a standard treatment that's going to treat the inflammation. The nebulizer is a temporary measure to open up the tube by dilating the tubes inside the lung so that the person can breathe better. But to deal with the problem long term, by long term I mean days, you need to put the person on steroid, keeping in mind that you have albuterol, you have different preparation of steroid. Namely, you have Decadron, which is a very good type of steroid. You start it IV, and then the person, it takes 6 hours to actually kick in, to really take effect. It takes about 6 hours. So you have to start it right away because it doesn't work immediately. It takes a while. And then you keep the patient on it. Then the decision has to be made during the course of the day or night with treating the patient. Is the patient getting better? Because every hour or so you go back and check the patient. And the key measure that you're doing is not only how the patient looks, that's very important, how the lungs sound, very important, and what's the peak expiratory flow. You give them another bout of this to breathe in. When I trained, we had the old-fashioned gadget, which was a very bulky stuff that we carry, and it was given to me by nurse in the White Plains emergency room the other day. I never saw such nice fancy stuff. I wish they had this when I was in training in the emergency room. This is neat, and you could carry this in your pocket very easy. So, and it's very important that all asthmatic really should have one of those. Unfortunately, most of them don't because they either can't afford it, they don't have insurance or whatever, and they just do the best they can. The emergency room is where they go to get the care. That's why the emergency rooms are so burdened in this country because most poor folks are not able to afford insurance. Hence the value of the Obamacare. The Obamacare has already covered more than 20 million people. In spite of all the negative stuff you have been hearing, because everything President Obama does, the Republican jumps on it to find a negative aspect of it. And this is the fantastic. Keeping in mind that many presidents before President Obama have tried to do something about the healthcare system in this country. They failed. This time, he succeeded. I mean, I myself would prefer universal healthcare, but this is not a perfect world, so he took what he can get, and they're criticizing the president for a program that's obviously working. I write the literature, I read the literature every day, 24/7. More than 20 million people have already been covered that were uninsured before. Before the Obamacare, there were more than 52 million folk without insurance in this country. Now that number has come down by 20 million. And the thing just started. Give it a chance. No, they don't want him to have anything success. They don't want him to have that as a legacy. And there's people they have no clue about healthcare. If they see quality healthcare, they wouldn't even recognize it. And yet, they're out there, open up their mouth, saying bad things about this program, which is working extremely well, providing insurance for people who didn't have it before, which is a great thing. I don't know if these people have ever been sick or their families have ever been sick to find out you have no insurance. One major hospitalization in this country is enough to bankrupt you if you don't have a lot of financial asset. This is a very serious thing. Healthcare, I mean, it doesn't matter who you are. You are nothing without good health. I don't care how wealthy, how poor, you need good health to be able to function normally as a human being. So give the president credit for all the other great stuff he's done there, jumping all over it. But this is a concrete evidence, objective evidence of something that he has done and the Democrats have done that have really made a big difference. So now, a lot of the asthmatics who had no health insurance before can now be covered by the Obamacare so that they can get the care that they need. Okay? And then, because, like I said, every day 11 people die from asthma. That adds up to about 4,000 per year. That's a disaster. That's a disaster, which is a disease that nobody should die from. Because an asthmatic attack is something that is, though the disease is a chronic and pulmonary disease, the attack itself is a transient thing once you treat it properly. Once you treat it properly, I agree that there are some chronic asthmatic who've been intubated. So physicians in the emergency room and the offices, they know who these folks are. They know that if they've been intubated once, chances are they're going to need to be intubated again multiple times later on. So they know that. So the red flag is up. That's why you ask the question of the patient, ask the question of the family member who are with the patient. What's the story here? How many times this patient been admitted for asthma? Not all asthmatic need to be admitted, but those who have been admitted frequently, it's almost guaranteed you're going to have to admit them again. You have those are habitual folks who get admitted all the time because of the severity of the asthma. And it is time that asthmatics stop self-treating themselves. It is a common thing that you go into an apartment and someone who has asthma and you find all these bottles on the floor that contain medication that the person did not take, and then they die because they didn't take the medication, they didn't treat themselves, they didn't take the albuterol, they didn't take the allopurin, they didn't take the steroid, they didn't take the antibiotic. You have to understand what you develop an upper airway infection and you are an asthmatic. That can trigger an asthma attack. I'm one of those who championed the idea that if you have a cold, you shouldn't be taking antibiotic unnecessarily. But if you have COPD or an asthmatic, you need to take antibiotic. There are people who disagree. I disagree with them because if you don't, the antibiotic, yes, it is a virus that's causing you to have the upper airway infection. But what they're failing to realize that in the upper airway are colonies of bacteria that live there as their natural environment. So long as the membranes in the upper airway are normal, they're quiet. They do nothing to you. But the minute that you got an inflammation, doesn't matter whether it is a viral infection or some other thing that causes the inflammation, automatically the damage is taking place to the membrane. That then allows the bacteria that sit there normally to begin to multiply. And then you have a combined infection. Okay? If you're not an asthmatic, you don't have any pulmonary problems, and you have a cold, it's just a cold. The virus will not respond to antibiotic. Okay, so we're just wasting your time getting antibiotic. Somehow, when people have a cold and they call the doctor, if the doctor doesn't automatically give them an antibiotic, they think this doctor is not a good doctor. In fact, the doctor is doing them a favor, because when you take so many antibiotics, you become resistant to them, and when you need them in a very serious infection situation, they won't work. However, if the person has chronic pulmonary disease, and the list of chronic pulmonary disease is quite long, and this book here, Ontology of Medical Diseases, there are several chapters on pulmonary diseases, including asthma. Chapter 69 is on asthma. There's a chapter on COPD, emphysema, and a whole host of other pulmonary disease that when somebody develops an upper infection, not only going to treat the acute problem, the decompensation that's going to occur, but you also need to treat the infection that triggers the attack to begin with, okay? And here, this other book, which is the latest book that I have that just came out, Health Status of African American. It has 804 pages. Chapter 32 is on asthma in black folks. That's right. And there are many differences in the situation when a black person is sick versus a white person. Many differences. And failure to talk about it, to teach about it, to teach student and intern and resident about this, because somebody is afraid that if you say anything about a Latino person or anything about a black person on television or on radio and print, whatever, somehow you are against white folks. This is hogwash. Total nonsense. Absolutely nonsense. The reality of it, the differences are so clear and so obvious. Now the powers to be have listened, not just to me alone, but to other folks. So now they're changing the entire medical education in this country. If all the things that I've been saying over the years, 22 years I've been doing this show, I have never once received a phone call, once received a letter from anyone in the medical community saying that everything I said was they disagree with or whatever. All I got is positive feedback, because the things that I'm telling you is the thing that I teach the students, teach the intern, how to practice medicine the Alcena way. There are many ways of practicing medicine. But I have objective evidence to show that if you're fortunate enough to learn it the Alcena way like I teach it, you got something good to take with you, okay? So the fact is now they're changing it. Big time. Not small time, big time. The AMA is out there giving grants all over the place to different medical schools. In fact, they just changed the M.A.C.P. It's about time, even the M.A.C.P that you have to take to try to get into medical school, they just changed it. Because they're listening. Because the system before was too old and too unrealistic. Every time you go to medical school, you're teaching a student medical school, the person that they have in front is a white person. And yet, they fail to understand the difference in physiology. There's nothing wrong with doing that, but you also have to tell them the differences in the chemistry, the genetic, and the physiology. The only thing that's similar is the anatomy. Everything else It's different. Believe me. And if you don't understand that, then you will not be able to make the proper diagnosis. You will not be able to do the proper workup, nor will you be able to provide proper treatment. That's one of the reasons why you have so many people, in particular in the minority community, dying of stroke, heart attack, congestive heart failure, kidney failure, because many folks who are ahead of me, who are still in my lifetime, fail to comprehend how best to treat certain diseases in these folks. Now they're listening. And I hope they continue to listen, not to me necessarily, and they should if they were smart. The students have listened, the residents have listened, the interns have listened. That's why some of them are doing so well, frankly, those that I had a chance to teach. The point is, asthma is a bad disease. It's a chronic pulmonary disease. The statistics are clear. 4,000 people die every year. 25 million people in this country have asthma. 1 out of every 12 people in this country have asthma. That represents about 8% of the US population. Worldwide, 300 million people suffer from asthma. 500,000 people get hospitalized every year because of asthma. And 3 million people show up in the ER every year because of asthma seeking treatment. Not mentioning those who go to private offices. That stat, you'll never get a hold of it, but I'm sure it's in the millions as well. The amount of schoolwork, the amount of school time that is missed school every day because the kids can't go to school because of an asthma attack. And the parent, one or the two parents, have to stay home, usually the mother, missing time from work to take care of a child with an asthma attack. The damage that has been done to the environment is such that unless it is reversed, the incidence of asthma is likely to continue to rise worldwide and, of course, in this country because people go for profit. Yes, it is a free enterprise system. Everybody have the right to make a living, but you shouldn't harm people in the process of making a living. You shouldn't do that. Cigarette smoking, cigar smoking, smoking of anything very bad for the lungs that can trigger an asthma attack. Those things are bad. So we'll treat you in the emergency room. We give you the bronchodilators. We give you the oxygen. We give you IV fluid. If you have an upper airway infection, we give you antibiotics, either IV or by mouth. If you don't get better after several hours of treating you, you're getting tired, you got to be admitted. Almost always to the intensive care unit where you can get closer attention from nurses and technicians, etc., so that people can watch you very closely. If the patient needs to be intubated because he or she is getting tired, the peak expiratory flow is getting worse than when the patient came in spite of treatment, that patient has to be intubated, put in a respirator to breathe for the patient while the asthma situations get better. And then you need the help always, always. Everybody with asthma need the help of a pulmonary specialist. Yes, the internists do very well. I'm an internist. But every now and again, when the patient crash, you got to call a pulmonary person to come and help you. The patient get intubated. They're excellent doctors. They know what they're doing. They're superb expert at managing these patients. That helps you. And remember the steroid. I got to tell you about the steroid story once more before I finish the show. That it was put together, synthesized by Dr. Percy Julian, a black biochemist, a black American biochemist who was forced to go to Europe to get his PhD because he was a Negro. They wouldn't allow him to do PhD here. And he's the one who biosynthesized corticosteroids and giving it to the world. And I'm here to tell you, next to penicillin, steroid is used more than any other medication in the world. You couldn't have eye surgery if it wasn't, there was steroid and the drop that the doctors give you to decrease the inflammation after the surgery. If you have rheumatoid arthritis, you need steroid. You have lupus, you need steroid. You have COPD, you need steroid. Okay? All the rheumatological diseases, you just name them, you need steroid in order to treat them. If you have Crohn's, ulcerative colitis, I mean, I can go on and on and on. You have meningitis, be it viral, bacterial, or fungal. You need steroid because the swelling that occurs in the brain, everybody who have major trauma to the brain, you need steroid to decrease the inflammation, and so on and so forth. So, and this man is no longer with us. He was a resident of Westchester, and you don't hear about him. Okay, and yet, look at what he did, that plus many other things. But I thought I would mention his name one more time because this is asthma, this is what he did. And I am giving him credit. I don't know anything about him other than what I read. But he deserved full credit for having done this, okay? Now, therefore then, asthma is nothing to play with. When you're not feeling that the medication you're using at home is working, call 911 so you can get to the emergency room ASAP. And in the emergency room, we know exactly what to do to take care of you, to save your life. Because if you keep treating yourself at home, you're going to stop breathing and go into respiratory failure and die. Respiratory arrest, I'm sorry, and die. It doesn't make any sense, okay? It's a treatable disease, a chronic disease, and it's nothing to play with. That's all I have to say really about asthma. Next week, I'm going to start talking again about pulmonary diseases. This time I think I'm going to start talking about COPD and emphysema. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.